Here with another important health topic. Take a little moment and just take a look at me. Look around. Can you see? Your eyes are very important, and we're going to talk about vision today. We're going to talk about eyes. We're going to talk about low vision and diseases that cause your sight to be lost. So obviously, we're bringing you today a ophthalmologist, Dr. Parekh, who's coming to us from Baptist Health, and we're going to talk about low vision. Welcome, Dr. Parekh.
Welcome. Thanks for having me, Anthony.
All righty. So let's first talk about who you are and what you do.
Sure. So my name is Prashant Parekh. I was actually born and raised in Miami. I was born at Baptist Hospital, and I'm a retinal surgeon. And so a retinal surgeon is somebody who, after we've gone through the whole undergrad, medical school, internship, ophthalmology residency, we do specialized training to treat diseases of the eye that are particularly in the back part of the eye, called the retina, the part that senses light. And the diseases vary from things related to trauma, accidents, as well as spontaneous things, genetic conditions, and the like. So there's a huge variety of the conditions that I treat. And part of the reason that I got interested in ophthalmology is one, as you see, I wear glasses, and I was always fascinated by going to the eye doctor and just being able to sharpen my vision with a few little clicks on the wheel, and what's better, one or two type of stuff. So it was always fascinating to me. And then my brother actually is albino, and so that got me even more interested in it because he has obviously an inherited condition, and that affected his eyesight. And so sort of those two things kind of piqued my interest even before med school. And I went to medical school at the University of Miami, got to spend a lot of time at Bascom Palmer, and saw a lot of the different, the breadth of conditions that were presented there, and just kind of took off from there.
Wow. So you actually, an ophthalmologist, you actually operate on the eye.
Correct. Yeah.
That must be like incredibly, I don't think even in med school, I went to University of Miami as well. I don't remember in med school even seeing that, but that must be just incredibly difficult, interesting. Tell us about that.
Yeah, all of the above. I like to think of it as it's a very meticulous type of organ and type of procedure, variety of procedures that we do. We have to be very meticulous. It's not a lot of blood and gory guts type stuff, and it makes a big impact on people's vision. And so I think there's a lot of gratification with it, but obviously you have to be very precise. Something we were talking about earlier was just the level of technology that we use. So we use microscopes, and we use magnify things. So things that are incredibly small in the eye, we're able to magnify them so that we could see well enough to do what we need to do.
Wow. Yeah. You don't appreciate your eyes or your vision until something happens and you have an issue. And obviously, it's something I've suffered with since a child. I've wore glasses as a kid, and then of course now wear contacts. And for me, in the operating room, for me, contacts are so much better. Even if I have to, God forbid, get up in the middle of the night to do surgery, I'm going to put up my contacts because of the peripheral vision that I get with the contacts. And in the operating room, I have to have that peripheral vision to see what's happening around me and so forth. So now you're an ophthalmologist. So tell us, for our listeners and our viewers, ophthalmologist, optometrist. A lot of confusion out there. And of course, me, I try to explain it to people, but what's the difference?
Yeah, it's a great question. And the idea is that I draw the analogy of sort of like the primary care doctor and the specialist. So an optometrist and an ophthalmologist, in terms of eye care, we're covering all of eye care. And so everybody has a different role. And so we look at optometrists as sort of like the primary care physician. They're doing a lot of screening exams. They're checking patients for if they need glasses or contact lenses. And if patients have issues with their vision, changes with their vision, oftentimes a patient will have the easiest access to an optometrist, especially if they've been going to them for a period of time where they were getting their glasses and contacts updated. And so we look at the optometrist as sort of the person to, like the catcher, to catch things. And if they find that there's an abnormality in any way, they can figure out and they can refer appropriately. Now, that's not to say that you can't directly see an ophthalmologist. But oftentimes there's a lot more optometrists in any given location than an ophthalmologist, just by sheer numbers. And so people have the easiest access to optometrists, and their goal, again, is to screen for diseases and refer appropriately so that the patient's needs can be addressed.
Yeah, and you're actually right. That happened to me because I have a buddy of mine who's my optometrist and who takes care of my vision and makes sure that I can see. and he noticed a lesion under my eyelid,
Right.
and that he didn't like. And he sent me over to your group, and they ended up starting biopsying it and watching it and so forth. So yeah, exactly that. He screened it, and of course I continue with him because I got to get my eyes checked every year, every 6 months, or whatever, to make sure my vision I can see. So yeah, I think that's a great summary. So today we're going to focus on low vision, and so it's Low Vision Awareness Month, and it's also macular degeneration. And you were telling me a little bit how they are connected. So let's start with low vision. When we're trying to create awareness of low vision, what does that mean?
Yeah, it's a great question. So when we think of vision, we think of the 20/20 number, and 20/20 means that when you're looking at an object from 20 feet away or 20 meters away, any fixed distance, that somebody who has quote unquote normal vision can see that two people, one person who has normal vision and you, if you're standing 20 feet away from an object, you're seeing it with the same level of clarity. That means 20/20. Now, low vision means that your vision is not 20/20. It could be, there's different varying definitions. It could be 20/40 or even worse. So oftentimes, for us, when we think of low vision, we think of 2200. 2200 means that for somebody who can see an object with the level of clarity 200 feet away, you, the patient, would have to be 20 feet away to see that object with the same level of clarity. So that means that's 2200. So generally speaking, when we think of legal blindness or low vision, 2200 or worse is where we're really, that's sort of the area that we're really talking about.
And is that acquired? That's something that you acquire? In other words, you had normal vision as a young adult, and as you become an older adult, you start losing that vision, and that's how we're bringing awareness to people that are losing vision in adulthood?
Yeah, that's primarily what we're talking about because of how common it is. But you can also be born with certain diseases that can cause low vision. My brother being one of my brother is albino, so the back part of his eye was not properly formed, and so he never had normal vision even as a child. And so there's inherited and there's acquired. Now, in terms of acquired, the main thing that we're going to be talking about today is macular degeneration because it's the most common cause of low vision or blindness in the adult population, particularly in developed countries like ours.
Okay, so let's go into macular degeneration because we're trying to create awareness for that. And I guess prior to telling us what macular degeneration is, we have to understand, I guess, how the eye sees. So let's start off with, how do you actually see and how macular degeneration impacts that?
For sure. So when we think about, the path of light as it comes in, the first structure it hits is the clear window to the eye, which is called a cornea. And it's, almost a semi-spherical, clear, completely transparent medium by which the light comes in. Then it goes through the pupil. Everybody knows, what the pupil is. The pupil is like the aperture of a camera. It changes shape depending on the amount of light that's around you, okay? And then after it goes through the pupil, it hits the natural lens of the eye, and that we talk about as like a focusing mechanism. So when we're looking at something close or far away, the lens changes shape to what's called accommodate. And as we get older, that lens has a reduced ability to change shape. It has a reduced ability to accommodate. And that's why a lot of people who are, maybe they went their entire, young adult lives until when they hit, sort of the middle ages, they start needing to wear reading glasses because they need that help with those reading glasses because the natural lens is not accommodating as much. And so after the light hits the lens, it goes through the middle cavity of the eye, which is filled with a gel called the vitreous. It's clear. And then it hits the retina, which is like the film of the camera. So the eye is very much like a camera. You got a lens, a focusing apparatus, an aperture, and then you have the film, which is where the light finally hits, and that's where the light is processed. And so that film that processes the light is called the retina, which is my specialty.
Oh, wow. And so what is macular degeneration then in all of that?
Exactly. So when the light comes in, it's projected on the macula, which is the center part of the retina. It's the most important part of the retina. And that is like if we go back to the analogy, it's the film of the camera. It's the most important part of the film of the camera. So when you're looking at something dead on straight ahead, that light is being projected to the macula. And so if you have any condition that affects the structure or integrity of the macula, then the pictures are not going to come out quite right.
And the macula degenerates because of age, because of a condition, because of lifestyle. We've heard so much about lifestyle, whether it be eating or smoking or exposure of environmental stuff. What causes that degeneration of the macula?
Correct. So when we're talking about the most common cause of macular degeneration, which is age-related macular degeneration, there's different factors. So there's genetic factors. We know that family history is very strong because there's different alleles or genes that toggle on and off that affect the metabolism of the retina, particularly the macula. And so there's that. Then in terms of lifestyle, smoking. That's the biggest modifiable risk factor for macular degeneration. So I have patients who have a family history, and they come in and we see them and we see little changes in their retina, and I can just, even through my mask, I can smell the tobacco, and I tell them, we got to stop this, okay? Because not only do you have one strike because of your family history, but now you got two strikes because of the smoking.
Wow.
So it's like putting kerosene on the fire.
All right. So how does somebody know that they may have macular degeneration or they're having problems? Of course, low vision, when you now can't see, or you need to wear glasses, or you have to go to the optometrist, you know that you're having problems with vision. And you talked very, very eloquently about the focusing and the reading glasses. So you go to your drugstore, CVS and Walgreens, and you buy the reading glasses. But what about this macular degeneration? How do I know that I may be developing this?
Yeah, it's a great question. Ideally, like any other condition, we want to try to pick it up early. And so some of the earliest symptoms that people can experience if they have macular degeneration is decreased contrast sensitivity. And the way that plays out in the real world is difficulty at nighttime. So people with macular degeneration or anything that affects the retina, they tend to have the most difficulty in low light circumstances. That's because the retina, if the integrity is not exactly normal, you need to increase the amount of light that comes in to get those cells to fire and give as clear of an image as possible. And so some of the earliest symptoms that somebody can have is just more difficult functioning in a low light environment. Think of an evening meal at a restaurant, like an Italian restaurant. You're trying to look at the menu, there's low lights. You're trying to go into a movie theater, so going from light to dark, and that change can be very challenging for people. So that's some of the earliest symptoms you can have. Some of the other symptoms are things that are supposed to be straight, they turn out to be a little wavy. And we actually have this thing that we use, it's a paper, or you can use it as a magnet. It's called an Amsler grid, and we'll try to show that here on the screen. And the idea behind the Amsler grid is that you cover one eye at a time, and you look at this dot right in the middle, and there's a bunch of straight lines. And when you're looking at those lines, they should all be completely straight, and you want to test one eye at a time. And if somebody has macular degeneration, oftentimes some of those lines will either be missing or they'll be crooked or wavy, and that's a telltale reason to seek help and get checked, ideally by a retina specialist. But get plugged in. If you don't have an eye doctor or an ophthalmologist around you, get plugged in, get your eyes checked, and go from there. So wow. That's some of the earliest stuff.
Well, I'm happy to report that immediately when he showed that, I put my eyes and I was checking and making sure that I saw all the lines, and I see all the lines, nothing wavy, nothing missing. So yeah, that's the Amsler grid, and you can do it right now on your phone, or look it up on the internet and use it. So now, obviously, there are different types of macular degeneration. Explain to us the different types of macular degeneration.
Yeah, sure. So there's two major types, which is the wet form and the dry form. When we think of something that's wet, obviously we're talking about liquid. And so what can happen in macular degeneration is it always starts off as dry, meaning you have these little ridges or little microscopic changes in the retina that are telltale signs that there is some degenerative process going on. Now, if there's enough disease there, we find that sometimes abnormal blood vessels grow in and they leak either blood or just fluid under the retina. So it's almost like getting moisture under your floorboard, and when you walk over it, it creaks and makes sounds, and it just doesn't feel right. So with the eye, the picture won't come out right. So it'll appear distorted or wavy. And usually if somebody has the wet form of macular degeneration, and they previously had the dry form, it'll be an abrupt change. So it'll be a very quick change. Whereas typically dry macular degeneration, although it's degenerative, means that it's progressive, it's slow, and it changes over a period of years, sometimes decades. But wet macular degeneration tends to change from one moment to another. And so if somebody notices a sudden change in their vision, a sudden waviness or distortion, where you don't even need an Amsler grid to pick that up, you can see that just by looking at straight objects in the environment, then that's a reason to get to an ophthalmologist, particularly a retina specialist, as quick as possible.
So you've obviously answered something I was going to ask, is when do we need to see you emergently? So we've talked about checking your vision. If you're noticing that you can't work in low light, you're having difficulty in low light, you've done that Amsler evaluation, you see some wavy lines or missing lines, you go to your optometrist, or find the retinal specialist like yourself, an ophthalmologist. Now, when somebody comes and sees you, what happens? They come and see you, doc, I did that Amsler, I saw you with Gonzalez on TV, and now I'm worried about this. What happens, and what is that treatment for macular degeneration?
Yeah, it's a great question. So when a patient comes in to see us, particularly retina specialist, we're going to check to see how their vision is. And ideally, if they wear glasses, we want them to bring their glasses or contact lenses, because we want to see what their best corrected vision is. And then after we check that, we will dilate their pupils, and then we do a really comprehensive eye exam where we get high resolution imaging of the back part of the eye, almost like a CT scan of the back of the eye, of the retina. And we're able to see in microscopic, we're talking about micron level detail, the intricacies of the retina. And when we do that, we can actually show the patient what is going on. Okay, so here we see mild changes. I can explain why you have a little bit of distortion, or no, look, you got liquid, or you have even worse, blood under your retina, and we need to do something about it. So if we just see dry macular degeneration type changes, then there's different treatments that are offered, but they're mostly conservative. Certain types of vitamins can be used, and around the horizon, depending on the type of dry macular degeneration that you have, there may be some local therapeutics that we can use. Now, the main therapeutics that we've had for, now we're looking at over 20 to 30 years is injections. And so we actually, if we see that there's a blood vessel that's leaking under the retina in the back part of the eye, we can actually use some topical anesthesia just right in our clinic, antiseptic solution, and we actually inject medicine into the white part of the eye. And that medicine diffuses to the retina, and it allows that liquid to be absorbed, and in most cases, vision to be recuperated, at least partially recuperated.
Wow, that's incredible. So if you have that dry, and you just see some areas of that dry macular degeneration, and you're using some conservative therapies, and you're using vitamins, is that going to progress? Can we stop that progression? Can you improve that?
Exactly. It's a great question. Right now, we cannot reverse the progression. We can't reverse the damage or changes that have already been done. And if the changes are mild, in many cases, they don't cause a whole lot of symptoms. They don't severely impact the quality of life of a patient. But there are some, depending on the level of macular degeneration, we have early, intermediate, and advanced. Advanced cases, that's where we actually have loss of some of the tissue. And so in that case, we would actually see blind spots in the patient's vision. And that can be very, very challenging to deal with for the patient. And so there are some therapies that are coming out that have shown some signals of being able to slow down the rate of progression for that advanced stage of macular degeneration. They're not FDA approved yet, but there is some expectation that they will be, and depending on that, we'll see how it does in the real world. But there are therapies and things that are being studied to try to reverse or at least completely stop the disease process, because it's a degenerative process and there's a lot of different factors involved. And oftentimes we can only study one factor at a time in an experimental type setting.
Wow. So in regard to treatment, you talked about the injection. Is there anything else in regard to that? I mean, do people ever need surgery for macular degeneration?
Oftentimes not. In the earliest stages before we had the injections, there was surgery offered, but it oftentimes ended up causing more of a problem than it solved. And so we don't do surgery for macular degeneration unless it's a very specific type of situation where a patient gets a major bleed potentially under their retina. And if they don't have, like, let's say if a patient only has one good-sided eye and that was the one that's affected, we may want to go in and surgically drain that blood and try to get their vision back as quick as possible. but those situations, thankfully, are few and far between.
So it looks like there's not much we can do with, except, well, definitely for the dry macular degeneration, there's not a lot to do, maybe some, some conservative measures and vitamins. So it looks like prevention is the biggest thing, right? Prevention in regarding eye care. So we talked about genetics, you can't change that. We talked about smoking, definitely that's one of the biggest reversible risk factor. Anything else that people can do just for general good eye care, not only for macular degeneration, but for any other eye conditions?
Yeah, it's a great question. There's been some studies that show that a Mediterranean diet has been shown to has been helpful. Diets rich in omega-3 fatty acids can be helpful for the metabolism of various tissues, and the retina being one of them. So there's something there that, there's enough research there to show that there's some potential benefit there. In terms of just lifestyle, I think that people talk about, screen time, right? We're all glued to screens, fortunately or unfortunately. And so I think limiting screen time just to give your eyes a rest and also just helping you sleep better, those are generally good things. So, making sure that you're not using devices, at least an hour, within an hour of your planned bedtime, I think is a good thing for a variety of reasons, not just specifically to macular degeneration.
So we know rest is very important. I've heard this so many times here on this show about rest, how it impacts all types of health issues, from cardiovascular disease and even mental illnesses and so forth.
Sure.
But in our eye, do we have a certain number of hours set of vision that God has allotted us? And if you don't use your eyes, 8 hours a day, you're saving up for later in years. Is that the case? Or because you talked about screen time, and I understand because a lot of focusing, and I guess the screen is not something great. But if you spent that time looking at the wilderness or just the nature, is that as damaging, not as damaging? Should you, 1 hour a day, just close your eyes and just relax and save that hour for later?
Yeah.
Can you run out of vision?
Not that we know. There's not been any studies to show that you can necessarily run out of vision. There are a set of inherited retinal conditions where the more light you get, it can actually, at least in a short term, impact the ability of impact your sight in a short term type setting. And so, but again, those are very rare conditions. So, generally speaking, no, you don't have an hourglass on your vision. But you bring up an interesting point in the sense of, should we be doing things more outdoors, wilderness, distance vision type activities? Because most of our activities in today's age are close by, and there's a lot of data right now about nearsightedness. Nearsightedness has skyrocketed because of developing nations and the tablets and the screens and the computers and everything, and the phones. And so out of the studies out of East Asia, where myopia has the highest prevalence, show that having at least an hour a day when they're studying children, because they're looking at your eyes obviously stop growing at a certain point. So as it pertains to children, we don't want children to be all very nearsighted or nearsighted at all, really, if we can prevent it. And one way of doing it is just keeping children, let them play outdoors, and diminish the amount of screen time as much as possible for children.
Another reason why that's just not good. Screen time is just not good for your vision at all.
Right.
Wow, incredible. All right, well, anything else you want to tell us about low vision and macular degeneration in regard to awareness of the eye that we want to make sure that our public hears and brings awareness on?
Yeah, I think, patients, like we alluded to, patients who have different conditions, macular degeneration being the most common, what can we do to really help them function on a day-to-day basis? And so, speaking about screens, the major positive that we have with a lot of the smartphones and tablets and things are that there are different settings for accessibility. So you can enlarge the print of the text that you have, and that'll help you see if you have low vision, enlarging the print. You can invert the color, so you can have a black background and white text. So that contrast, basically increasing the contrast by doing that, helps immensely for patients who have visual issues. So just those two things alone are default features of a lot of our smart devices. Things that can help also in terms of day-to-day activities are, when you have macular degeneration or other things that affect the macula, are increasing contrast using certain types of glasses. and one are just magnifying. So when we think of magnifiers, it says, okay, I can magnify this 2x, 3x, up to 5x has been shown to be really helpful. When you go beyond 5x magnification, you get a lot of distortion in what you're trying to look at. But if magnification is very, very helpful. And the other thing would be there are certain type of tinted glasses, tinted sunglasses that can increase contrast. Those blue blocker type glasses that you used to see those commercials for. So a green or a yellow tint. Hunters often use the glasses at nighttime. That can be helpful too. So I think just the visual aids often are overlooked in our settings of, okay, I can't help you right now directly with the treatment, but how do I help you function in day to day? And then the other thing is, dealing with the aspects, or psychological aspects, economical aspects of having low vision. Somebody, especially if it's, as you were talking about earlier, acquired. You had normal vision, and then it's slowly gone down. Now you're not able to work. Now you're not able to provide, for yourself or your family. What resources are there available for patients like that? And the Miami Lighthouse does a great job at supporting patients. They have support groups, and they have occupational therapists and different resources available to help patients transition from a quote unquote sighted life to a less sighted life, and still able to do things and function. There's a lot of successful people who are completely blind. And so we have to be able to pivot depending on what the situation gives us. And I know you know that more than most people. So
wow, no, that's great information. And you talk about the Miami Lighthouse. I was at a gala, and they had a youngster there who's blind, obviously, and tremendous voice and tremendous performance and so forth. So it's just there's always an ability. They have other abilities, even though you don't have the sight. But I think the key point that you talked about is not only the care and the prevention, but also all of the other accessory items that we have, changes on your phone or glasses and so forth, to really help. So I think it's great information. You've given us great information today, and I obviously want to thank you for being here with us. And as we were alluding to at the beginning, we're talking about low vision. So take care of your eyes, get plenty of sleep. Don't be involved in those environmental factors that are going to affect your vision, like smoking. Rest your eyes, give yourself some free time away from the screen. And if you have any problems with your eyes, you're concerned, go to that primary physician first, which is the optometrist. And then if there's an issue, you're going to see a specialist like Dr. Parekh, who will see you as an ophthalmologist. So thank you, Prashant, for coming to see us. Thank you for giving us all this information. And once again, Dr. Anthony Gonzalez here with Miami Community Health, signing off. Have a great day. Take care of yourself and your family. And of course, take care of your eyes.